Good morning, Milton. How are you doing today? I'm doing fine. I was a little scared coming in this morning. I was in the Navy. Okay, I was in the military, and I knew today I heard we were going to be discussing the SHIIP program, and I was a little scared because I thought I might be getting shipped out and be leaving for another 6 months. But that's not at all what the SHIIP program is. We're going to talk with Melinda Houser, who's a family counselor and coordinator with the SHIIP program, with the Lincoln County Extension Center in service. And also we have a volunteer counselor who's volunteered since 2003 with Lincoln County Extension Service, Valorie Spearman, here with us today. And, I'm just so interested to hear more and more about those programs. And those programs exist in, I understand it, most all communities in North Carolina, not just Lincoln County. And we cover 16 counties, very proud to do so, and want to make sure that we speak to Lincoln County, but also relate that to the rest of, say, Western North Carolina as well. And just before we start, I just have to say I visited up there a few times at the Lincoln County Extension Service, and they have such a nice facility up there, right close to the courthouse, court square there on one of the main streets going in just before you get to the courthouse. And they have a great group of individuals who have come, and we've sat around and done some educational talks about bucket list and planning, and I've learned a little bit more about what the Lincoln County Cooperative Extension Service does. But without further ado, I'd like to introduce Miss Melinda Houser. How are you doing today?
Good, thank you. We're glad to be here.
Well, We're glad to have you. So, I understand that you know Milton Baker pretty well. Is that right?
Yeah, we've known each other for a long time. Yeah, because I did radio programs when he was in Lincoln, and we did like a weekly program.
A weekly program
and
with somebody.
Between our staff, like the ag agent, the 4-H agent, and also Family Consumer Science, and that's who I'm with. I'm a Family Consumer Science agent. So we did programs. We took turns doing the programs.
So Milton, I'm just going to turn the interview over to you. It sounds like you are extremely familiar, more than myself even, with the Lincoln County Extension Service. Is that right?
Yeah, a few years doing shows like that. I think we did the show for about 8 years.
Oh wow, 8 years every week.
It was a long time, and I got to know all the agents over there. Now Melinda's still there. A few of the agents have changed, and new directors coming in. They still do a great job. And we talked about the SHIIP program a lot over the years. Teaching today program. Have any questions about the SHIIP program? These folks there can tell you more about it. Train volunteers, not selling insurance, understand what might work best for you. And then I just what we could talk about today.
Okay, I was going to tell you too that SHIIP's been around since 1986, and it really, North Carolina was one of the first states, and also North Carolina is like a showman, so to speak, for the SHIIP program, because it's a lot of states model their program after North Carolina, and it's one of the top ones. They've been recognized so many times in North Carolina.
So it has nothing to do with the Navy. I don't have to go away on a ship today. Okay, good. Just making sure.
No.
I can relax. It's insurance.
Yeah, and it stands for Senior Health Insurance Information Program.
Senior Health Insurance Information Program.
Right,
okay?
Right. So there are a lot of changes taking place, and Valerie and I were just talking a while ago about a lot of the premiums. A lot of the insurance companies are dropping people from insurance and that sort of thing, but we'll get more into that later on. But I want to mention too that some of the things they work with is the Medicare Part D, the prescription drug program, and we'll talk about open enrollment. Might want to mention that too when we come in there. And Medicare supplements. And it's amazing. We have open enrollment beginning October the 15th through December the 7th, and it is full speed ahead. They were there every day, right?
Yes.
Yeah, 9 until 3.
Yeah, 9
and
until
every day. And then we have also a satellite office down in Denver. It's a Christian ministry. We have a person who lives within a mile of Christian ministry, so she's there. We set up an office down there so that we can reach the people down in the eastern part of the county. But this person also comes up in our area too. We're in the James Warren Citizen Center. So it's just amazing what some of the things that's taken place during there. And one thing that's so interesting is how much money they have saved citizens of Lincoln County. We have people coming from other counties to our county too to make use of the program. They saved thousands of dollars. I believe, what was the highest
It was
figure?
over $400,000 last
How?
year.
How do you do that? Explain it to me. I know it's insurance. I know it involves seniors.
Right.
But is that health insurance? Is that a Medicaid supplement?
This is strictly prescription drug cost.
Prescription drug costs?
Yes.
Okay.
What happens is a lot of the different, we had 22, I think, different plans last year for North Carolina eligible participants. And a lot of times the prescription drug plans will drop a medication or go up on the cost of the prescription drug plan. So what we do is we put in all of their medications and try to find the lowest cost prescription drug plan for them for the year.
Mm-hmm.
So if your drug costs $500 and your plan has dropped that particular drug, if you didn't change plans, you would be paying $500 for the cost of that particular drug. So we may be able to change it to one that would only cost you $15 for the cost of that same drug.
And you can do that because you're plugged into all the information.
Yes, Medicare has
You're an
online
expert at
system
doing
for
that.
us. Yes, and we go
Okay.
online and we give people options. We do not tell you what plan you should choose. We give you the information. We typically focus on the top 3 lowest cost plans for the individual, and we review those with them. And a lot of times people may not want to go with a particular plan because each particular drug plan is associated with our pharmacies. And there's preferred pharmacies and then just your normal pharmacy that covers the Part D plan. If you go to a preferred pharmacy, you can save more money. So some people don't want to change to the particular pharmacy that was with that plan. So they may choose to pay a little bit more. Or there may be a plan that has a deductible of $360 that they don't want, so they may pay a little bit more to keep from having to pay that particular deductible. Because January, February, March, people don't have a lot of money because they spend all their money at Christmas time. So they want a plan that doesn't hit them up front for the $360. So they may not always choose the lowest cost plan, but we do help them find the plans that will save them the most money.
Another issue I think that's relevant to talk about, a lot of people think, well, I'm not sick, I don't take medication, I don't need a drug plan.
Mm-hmm.
And I said, what if you have a heart attack or a stroke tomorrow, what are you going to do? You know? And so many people don't, and they have to pay a penalty and when they finally sign up, right,
Yes,
they have to pay a penalty from now on.
yes, and it never goes away. And it's around 3 cents, 3.7 cents, I think, per day until you take a plan. And that penalty will never go away. It'll always be added to the current premium cost.
So you get penalized. It costs more in an emergency when you need it than for planning ahead, right?
If you do not take out a plan, and in December, well, between November and December, if you don't select a plan, in January, if you suddenly get, God forbid, cancer or anything like that, you can't just go get a plan.
Right.
You cannot enroll until November of the year, and then it will be effective for the next year. So it's not easy to get a plan to help you. So it's better to be preventive instead of be proactive toward the cost of your prescription drugs.
Because when you sign up, the plans aren't that much. If you're not on a drug, what's the lowest cost on some?
$18.75 was the lowest cost, and we have some that go up to around $88 per month. But I seldom sign anybody up for those plans. Just because the plan costs more doesn't mean it's the best plan for you. Each person is different. If your neighbor is paying $18 and we're telling you the lowest cost plan for you is $33, your neighbor's not taking the same medication that you're taking. Everything is based on the particular drugs that you take at the current time. So you may be paying more than your neighbor, or you may be paying less than your neighbor, but you're still going to be paying less than you would if you didn't have a plan.
Well, it sounds like we're preaching the same thing. I mean, I talk all the time about planning ahead and how it's cheaper, much cheaper, to have powers of attorney in place, general durable powers of attorney, healthcare power of attorney, living will, and maybe some deed planning to protect property against a tragic situation that might happen with healthcare, that might put you in a nursing home or assisted living facility for a time, that takes all that money and property. And it costs much more to do that in an emergency to protect it than it does to plan ahead. It costs a fraction. I mean, guardianships are expensive and they're court proceedings. And once a clerk has control, once the courts have control of all the funds, then they're just locked. There's not a lot that the family, there's very limited ways the family can spend those funds. Very limited ways. So I preach the same thing in the realm of legal protection for assets.
To pay for their medication, and they would rather do without, they've got to make a decision to drugs.
And you run into those people a lot.
We get a lot of people like that who don't even know that there's programs out there for assistance, and it's called the Extra Help Low Income Subsidy. So that's another program. If we have someone who comes in and says, well, I can't afford that for my medicine, we look at their assets and what they're actually, if they have any additional benefits. A lot of times people think, well, I might make too much money, or we're going to look at the cost of their house or things like that. But what we look at is the money that they have in their checking account, if they have an IRA, if they have a pension fund, and if they qualify for assistance, then they may pay no more than $1. I think it's $1.35 now to $2.65 for their prescription drugs. So we have other options to look at for people as well as just the actual cost of their medication.
So go ahead, sorry.
Excuse me. I was going to say we work real closely with Social Security, and we have a
DSS too.
DSS. Those two folks, we all combine together. It's a coordinated program, really, in that, because a lot of people go to DSS and they can get on some of their programs, and then Social Security, and we have an inline, thank goodness, with Social Security and DSS, and it's a great comradeship, so to speak, that we work together, and it's important on that. So
what DSS does is they will, if someone qualifies for Medicaid, then they will send them to us. In the past, your prescription drugs used to be a part of Medicaid, and now it's not. It's separate out once you turn 65 or go on disability. You may qualify.
You mean Medicare?
Once you qualify for Medicaid.
Medicaid, okay.
Yes. People might not qualify for
I'm already here too.
Okay. People who may not qualify for full Medicaid may qualify for assistance with their prescription drug.
Okay.
They work separately now. So if you have what's called full subsidy and partial subsidy.
Okay, full and partial subsidy.
So full subsidy would pay for your Medicaid as well as your prescription drug plans.
Okay.
Partial would pay for your prescription. It could pay for your Part B premium, which is $166.
Yeah.
This year, and it will also pay on your medications. And it can pay anywhere up to, it may pay up to 75% of the cost of your medication if you don't qualify for the full partial subsidy. The monthly incomes, would you like to know what those are right now?
I'd love to.
For this year, if you're an individual, to qualify just for the partial subsidy, if you didn't qualify for Medicaid, if an individual, your monthly income limit could be $1,485. With your resource and asset limits is $13,640.
Okay.
That does not include your home or your cars. It just includes your actual money available to you. If you're a married couple living together, your monthly income limit is $2,002.50 for the couple, and your assets limit is $27,250. So if you come in to seek help with us, and you say you can't afford your medication, then we may either send them to Department of Social Services, or they can talk to someone in Social Security, or we can fill out the application for them for the low-income assistance.
And that's really important when you think about the things that are available. We also have people on disability who are aged in their 20s, 30s, 40s, and they have signed up for these programs, and that saves them bunches of money. I mean, because a lot of these people are married and have children, so that it's really a hardship financially for them, and that's something to think about when.
So you know people who are trying to choose whether to pay for food versus medication?
Yes, I do.
That's
Lots have come in like that.
It's sad when we get
that's sad.
Yeah, so we try to do everything we can, and a lot of times, even if people don't qualify for the assistance, there are other options that are available. Sometimes there's some of the actual pharmaceutical companies offer assistance on certain drugs. Unfortunately, a lot of them will not offer assistance if you're on Part D, but there are some that do. So we go online and try to find those companies for them and help them. A lot of times, I will send them back to their doctor and say, because the doctors don't really know what the patient is actually paying for their medication, and just say, look, I can't afford this medicine. Is there a program out there that will pay for it? And most of the doctors are aware of this. One in particular, one is people that are diabetics. Some of the diabetic insulin shots are covered 100% once you go into the gap. And the doctors know this, and they can help them with that, with paying for their medicine to get it paid free, get it covered free for the entire year.
Another one is Helping Hands. Occasionally,
some people helping hands that can help with their drugs. Or I print out what the actual cost of the drugs are and say, go to your doctor, let them know what you're having to pay. Is there another drug out there that might be a lower cost for you that would do the same thing?
Or a generic or something,
Right.
just something that could do it the same job but at a cheaper cost.
Right.
Well, that sounds like a great program, and something the community of Lincoln County is extremely blessed to have you.
So we have 5 counselors. And
5 counselors.
5 counselors.
Okay.
Yeah, and they all are busy and they have done a great job. We're one of the top counties, I guess, in North Carolina as far as what they have accomplished and reaching people and saving money. There are a few people that, I hate to say this, can't be helped. We've had maybe 1 or 2 out of the situation, whatever. There's nothing works, but we also go to Christian ministry sometime and ask, and then some churches can help these people sometime with certain things. And
I find that there are a ton of benefit programs out there. For instance, one is Veterans Aid and Attendance, which is a lifetime benefit that I help people obtain as a Veterans U.S. Department of Veterans Affairs certified attorney. But nobody knows about it. Very few people know about it because the VA doesn't have the resources, I think. It's not that they don't want to necessarily, but just doesn't have the resources to advertise it. And people are amazed that they can get a benefit for life, monthly benefit, to allow for them to stay in home and be cared for, or contribute to paying for nursing home or assisted living care.
that's excellent.
And this is a similar benefit that I was not aware of. I was not familiar. I've heard of the SHIIP program. Okay, I won't say I haven't heard of it, but wasn't in depth. Familiar with it in depth. And that's something we do on the Elder Law Report, is bring information that may not really be advertised in the community as much as is needed to the public and to seniors. So it sounds like, though, you have 5 counselors there, and I know the I keep wanting to say NC. Lincoln County Cooperative Extension Service is extremely active in the senior community. I've been there, and I know you have.
Yeah, we've had that program. Gosh, how long have we had this program? 20 years, I guess.
20 years.
The Part D part started in 2006. That's when the prescription drug program came into effect, was 2006. So we've been very involved since then.
The sad part about it changes so much, and people don't know what's happening, and that's the reason we have this program that inform people about the drug plans that change. I mean,
any benefits program
it's unreal.
changes. Like, for instance, you just gave a lot of information about a Medicaid benefits program. I do Medicaid crisis planning for families all the time, but it's a totally separate program, okay, than what you're dealing with. There are so many different, even the word Medicaid can encompass so many different programs. It's unreal. So
And people are embarrassed sometimes, but they shouldn't be embarrassed about this.
No.
I mean,
So who pays? All right, let's talk about that for a second. All right, you're going to get me on my high horse, okay? And that's where I feel very comfortable, actually. So everything my teachers used to fuss at me about work great for me now, okay? Which is getting really excited and talking, right? So your entire life, you pay taxes. Sometimes up to 45 to 50 cents on the dollar. If you look at property taxes, income taxes, any kind of sales tax that you're paying, and you're working hard for this money in some type of industry in Cleveland, Lincoln County, or somewhere in Western North Carolina, or wherever you may be. So you take that little 55 to 50 cents on the dollar that you're left with, and you try to accumulate things during your life. And this is also what I call a middle class trap too, okay? Because if you're really super poor, that's fine, it's not nothing, but you're going to get benefits, and you understand that. I think you don't love that, right? But that's if you're really super rich, you're going to plan for that. You don't need it, right? And you're going to legally protect yourself, but you feel guilty as a hard-working middle-class American to go access a benefit. That's what I see a lot of times. But you don't understand, I think, that you pay for that benefit. You created it with your tax dollars. Now, it may have dwindled because of, but not your fault that it might be dwindling, or Social Security. Those things are misappropriated or reappropriated by the powers that be all the time. That money's moved around among systems for different reasons. But it should be there for seniors. You created the pot of money by all your hard work, all that money you were missing throughout all of your paychecks throughout your life. And then to access these programs, you talked about asset limits, right? For married and single people.
Yes.
And I deal with asset limits for married and single people, for people who are going into a nursing home or assisted living facility all the time, or a secure unit for Alzheimer's dementia. And at that point, you're asked to spend down almost all your assets that you've worked for with that little part of your money that you were able to scrounge out of your paycheck before you can access the benefit you paid for. I just dropped my pen. I mean, it makes me mad. That's their system. That's the system we struggle with. And then on top of that, there's guilt by the people that need to access it because of that hardworking mentality. They don't want to freeload, they think, right? So they don't want to access it.
Right.
I'm going to get angry hate mail.
I try to put people at ease, and one of the ways I do that is that they're like, hey, my mother-in-law was on Medicaid in South Carolina. There's not I don't see any stigma to being on Medicaid, because a lot of times people can't live off of their Social Security.
Right.
$400 or $500 a month, you can't live off of that.
No, you can't.
So there's nothing wrong.
That's the money. That's the
make
food
people
versus
believe.
prescription drugs person. Okay.
And one thing that we have done, and Christian Ministries has told me, if you come in and somebody tells you that they're having to choose between, medicine and food, we'll bring you boxes of food up there to keep in your office to give to them.
Right.
That's at East Lincoln Christian Ministries. So
Right.
we work closely with them so people don't leave hungry. I had one guy that I helped. He said, you'd be surprised how many ways you can fix ramen noodles.
I mean, that'd be like going back to college for me.
Right.
Ramen noodles and hot dogs. You can chop hot dogs up in
Oh, he did that too. Yes, he told me all the ways to fix ramen noodles.
Yeah, because we have hungry people in our county, and that's one of the
Sure.
things that's happening with this, about the drug plans and that sort of
And
thing.
we want to help people every way we can.
Yeah.
We may even go out of the way, but we try to work closely, like I said, with Social Security and DSS, Christian Ministries, all of the local areas, just to find help for people.
And it's working too, and it's just so much out there. So many people are in need. You know what I mean?
Yes, there
Especially
are.
about this.
Yes, there are.
Yeah, and one thing I want to mention too is fraud. We emphasize that too, and I wanted to share something with you on this. Examples of fraud and abuse, and it's happening everywhere. And we're talking about people being billed in the hospital or by doctors, billing for services, supplies, and equipment that were not provided. This can happen. And I want to mention, you get a Medicare summary that comes in, and people need to look at that Medicare summary. and see, because we've had people be charged for things that didn't even happen in the hospital, or go to the doctor's office, things being charged for. And people are human and they make mistakes, we know that. But people need to be aware of that. And another thing is calling Medicare beneficiaries and asking for their Medicare number. People getting phone calls wanting their information, and some people have been robbed by thousands of dollars and will give their information over the phone, their Medicare number or their whatever. And people have been taken. In our county, I know that for a fact. I have turned in 3 different fraud cases to the Department of Insurance, and this was happening. So please, people need to be aware of this. It's happening in our county. It's happening in all counties, because people are out for money they can get, for drug money or whatever. So this is happening to people. And one thing I want you to remember too is don't give out your Medicare number to anyone who asks. Only your doctor or your other Medicare provider should need it. Another thing is, don't give your Medicare number to telephone callers, I mentioned that, or to door-to-door solicitors. We had a case happen in Boulder Cities a few years ago. 2 people came to this lady's door and said they were wanting to talk to her about her insurance. Well, both of them came in, and this one man detained the lady, telling her about insurance. The other one went through the house and just robbed her blind. She wasn't aware of what was going on with it. And then they left, and that was it. And she took all kinds of valuable things out of her house. And not only that, so people aren't supposed to come knock on your door and say, I've got this particular insurance program I want to talk to you about, your Medicare, whatever. No, that's a fraud. It doesn't happen. And it's happening right here. I want to emphasize that over and over. So it's so important. That's one thing.
Well, I thank both of you, ladies, for being here today and for doing the noble work that you're doing. Appreciate it. And if anyone wants to get in touch with you to learn more about the Lincoln County Extension Service, you offer much more than just the SHIIP program.
We do.
There's all kind of activities and classes and other things that you can get involved in there. And you have raving fans that come there all the time. I know. I've interacted with some of them. And they're fun. But how can they get in touch with you?
Okay, we have a phone number, and I'll give it over. It's 704-736-8461. Because I mentioned we have an ag program, we have 4-H, which is youth and leadership and all that, and then I do the program of nutrition and other stuff that we do too. I have organized group, ECA, Extension Community Association, and they do lots of projects in the community, lots of for different organizations, and we teach a lot of different classes. We did one yesterday on nutrition and planter. They did a container garden with herbs, and we talked about using, anyway, there's all kinds of things going on that you may be interested in. And I will mention we have a grant for this program, SHIIP. We have a grant that I apply for every year, and it's through the Department of Insurance. It's not a lot of money, but that's what we buy our supplies, and we do educational programs. We did a Medicare program not long ago, and we had about 75 people there that came. And
We visit churches.
we go to churches and give programs and despise their supplies, and I pay for their mileage. That's the only thing we can't pay them a salary, but we pay for their mileage, thank goodness, with this grant money. So it's only about $3,000, which is not a lot of money for a year. So.
And there is another number if you don't live close to downtown Lincoln County or to Denver. There's a SHIIP number through the North Carolina Department of Insurance. It's 1-855-408-1212, and they can give you the name and location of the nearest SHIIP office for you, or they can actually answer your questions there too.
Well, listen, ladies, thank you so much for being here today. We've been my guests today have been Melinda Houser, who is a coordinator with the SHIIP program and family counselor with the Lincoln County Extension Service, and Valorie Spearman, volunteer and counselor since 2003 with the SHIIP program in Lincoln County. Every community has something similar. Find your extension service, your senior services SHIIP program counselors, and talk to them about how you can save money on your prescription drugs and how that can help you or a loved one that you know. This has been the Elder Law Report. I've had a lot of fun learning today along with you. And again, I'm Greg McIntyre, the Elder Law guy. I am an Elder Law attorney with McIntyre Elder Law. And Milton, thank you so much for hosting us today. And I'll tell you what, if you have any other questions, want to get any information, about that information as well, and other planning services and legal planning services, you can call our office. That's McIntyre Elder Law at 704-259-7040. And this has been the Elder Law Report. Have a great weekend. Perry Mason. Thanks, Bill. So,
Thank you.
thank you.
Thank you.
That was very easy. You did a great job.
She's
The
good.
one thing we didn't even talk about was people that turning 65.
I know. There's so much in
People
the
turn
program.
65, there's
And I-
total confusion.
So what we could do is a part two. We do part two all the time, okay?
Yeah.
And we can work on that. All
We'd
right.
like to focus more on people that need assistance because that's what our
That's
goal
what
is,
our
to
goal
go out
is,
and
yeah.
reach into our community and get people
Right.
that can't afford their
Yeah.
drugs.
Right.
We have people coming to us, you aren't anywhere near 65 yet. But the reason I got
Me?
involved in
Okay.
this is whenever
I'm 29.
my husband's, the year before my husband started turning 65, he's 9 years older than me, so he turned 65. And we were getting bombarded with mail a year before he turned 65. And I thought, I don't know what I'm going to do with this. So I retired from Duke Energy and Human Resources. And my husband retired from Duke too. So Melinda came and gave a talk, and she said, we're looking for volunteers. So I thought, I know these people, I want to find out what's going on. So I signed up for the training. That's why I did it, so I would know. But people come in all the time, I'm getting bombarded. What do I do with all this mail?
Yeah.
How do I make sense out of it? So that that road to 65, that document we just gave
Okay.
you is very, very good at showing people what to do and their timelines that they have to do it in. That's a great
I frequently blab about things to everybody that we do on the radio show and to clients in my office all the time as well. Okay, and I thank you for being on. If you have other things to talk about.
We're
because
doing this.
You do other things besides SHIIP too.
I know y'all want to come and be part of that program. We have vendors coming that day. Huh? We're going to Tuesday.
Yeah, those are fun.
Yeah.
That would be great.
If y'all want to come and set up a table,
Sure.
would you want to do that?
I'd love to do that.
Okay.
I'd like to set up an office in Lincoln County. Well, that's my goal to expand. We've been
Well, let me
trying to do
know.
that. It's just, I've got 50 things I want to do and only so much time and resources, to go around.
So we provide a table, and
Okay.
is one, that's enough, is
Sure.
the table.
You do drawings? That was,
Yeah, we give,
Bring a door prize?
yeah, because we give door prizes and give drawings, and it starts at 9, so if you want to set up early that morning, or bring your stuff the night, day before, we do it between 2 and 4 to set up. You may want to just wait that morning and bring your stuff.
Okay.
We open the doors at 9.
those people love to come in and get little goodies.
Yeah. And they'll talk to you too, because they're looking for something. I mean, they need help, you know what I mean?
Well, I mean, if you plan ahead with anything, it costs a fraction of the cost. The
Don't
problem
need to
is,
sit-
though, is people are only motivated. A lot of times people will wait. They'll put it off, and they're only motivated when they figure out, oh my gosh, I got to pay this much,
Yeah.
thousands of dollars a month for
drugs.
drugs, yeah, for medical.
I'll tell you what, my mom.
Or we're gonna lose
a
our
lot of
house.
older people won't tell you anything
No,
about their assets.
no.
But my mom, after my dad died, we immediately put